Perfect. All right, now, here we go. All right, online clinical supervision. What you should know is the name of the presentation. I, again, am Rachel McCrickard, AAMFT. I'm going to go through a little bit about my story just to provide a little bit of a foundation for why I started Motivo and how I stumbled across this problem. So this is a picture of me when I graduated with my master's degree. I had just completed my master's from Azusa Pacific University in marriage and family therapy, and there were two things I didn't know this day. One, no one told me that my graduation cap was on backwards. I walked away around the whole day like that. And then two, I didn't know that it was going to take me 3 more years and $8,000 more in order to obtain a license as a marriage and family therapist. So something I say a lot is that for a therapist, getting your degree is actually the easy part. It's often becoming licensed that is so hard, that process of clinical supervision. And it's hard for a number of reasons. Obviously, you're a brand new clinician in the field and you have clinical supervision, you have field placement, you have the track your hours and the licensure exam before you can become licensed yourself. And that's often an arduous and can be a pretty expensive process as well. We all know what clinical supervision is, but just in case, it is the 2 to 3 years that a new practitioner spends face-to-face meeting with a more seasoned therapist called your clinical supervisor to receive consultation and guidance on how you're developing as a new clinician. And you're working under their professional license. However, supervisors are often difficult to find, and they can also be kind of expensive. A lot of supervisors charge their normal hourly rate, which can be cost prohibitive sometimes for a new graduate. So that was definitely my story. I lived in a rural part of North Georgia, right under Chattanooga, Tennessee, and the closest AAMFT approved supervisor was 2 hours away in Atlanta, and so I drove every week to get to the closest clinical supervisor, and like I said, paid about $8,000 to get the hours that I needed for licensure. And I think that this is a process that many people go through to find good clinical supervision, either outside of their local area or outside of the agency that they might work for. I stuck with it and got licensed in 2011 in Georgia, but I noticed in 2016 that Georgia passed a very clear licensure rule. It's called their telemental health rule that gave permission for therapists to do all of their supervision through secure video conference if they had 9 CEs in continuing education for telemental health. So that's what gave me the idea for Motivo. I started looking into other states and realized that about 45 states had recently begun to allow supervision online as well. Can you mute all the participants, Alyssa, real quick? Yeah, thanks. Supervision online as well. And so I thought, you know, that would have been a much easier process for me to be on secure video conference rather than driving to Atlanta. So that's when I created Motivo, which is basically a directory of clinical supervisors that are available for virtual clinical supervision. So we are both a directory for finding a supervisor, but we're also a full HIPAA compliant solution for managing a supervision practice. So obviously there's video sessions available there. You can also schedule your sessions as in-person meetings if you just want to use the platform more as a electronic medical record, if you think of it like that, for your supervision practice. Scheduling, billing, hour tracking, and then session notes are all incorporated into the platform as well. I'm gonna, maybe I'll just stop sharing right there and see what questions that you guys have so far. I don't want to run through this too quickly. I'm just curious, and you can unmute yourself and ask, or you can say in chat if there's any questions that you have so far. Anything come up? Yeah.
I would just like to ask, what would be the basic difference between this platform and something like using Doxy.me or even Zoom Pro, which is HIPAA compliant. If you could just speak to that a little bit.
Sure. Yeah, absolutely. Yeah. So there's many telehealth platforms. And I mean, I think that if you're looking for just a video conference solution, yeah, there's a number of secure HIPAA compliant video sessions that you could utilize for that. I think probably what makes Motivo unique is the marketplace element. There usually isn't a marrying together of both a software tool and a place to find supervisees or for supervisees to find you. So this kind of marries those two together. So being a place where supervisees or new graduates are going to look for a supervisor and then finding them. So I guess it's kind of a merger of like Psychology Today and Doxy Me, and different from Zoom. You know, Zoom's just a great video conference solution for scheduling video calls, but to have like the other elements around it. And I'm happy to do a demo so that you can kind of see what the platform looks like in action, and how it differentiates from just the basic Zoom. Is that helpful?
Yes, that's helpful as well. And maybe I'm happy to hold this question if you're going to talk about it, but I know that I work at a university, and I know a number of our faculty who supervise students and postgrads are maybe more with postgrads. They're concerned about the liability of supervising someone that they don't know well, and that person coming under their license as a supervisee. And so I'm wondering, how is it just dependent on the supervisor being kind of a good fit for the supervisee and vice versa, like a client therapist relationship? Or how would you recommend supervisors go about, for lack of a better word, vetting supervisees, and if that's a good fit for if they want to take that risk?
Yeah, let me hold off on that one, but when I do the demo of the platform, and I'll tell you how we go about matching two people together. And I think that will be covered there. Yeah.
Great, thank you.
Cool. And I'm seeing a lot of questions too that I'm also going to go over here quickly. So let me just go through a few slides about best practices for using telesupervision, and then I'll talk more specifically about Motivo, because I want to answer those questions. If that's really what you came to this to know about, is how do you use Motivo for this purpose? Cool. I can spend all day on that. But I just want to go over some of the best practices that we think about when we're talking about the delivery of telesupervision, agnostic of where you're delivering it. So a few supervision pain points that exist: time and expense. We've already talked about this. This is often new graduates coming out of their graduate program and not knowing where to start. A lot of the directories that exist for supervisors are static directories. They're not necessarily updated with who's taking on new supervisees and what the rate is, and some of that kind of stuff is difficult to determine sometimes. And then if you don't have a supervisor in your local area, like I went to AAMFT's listing of supervisors when I was looking for a supervisor, and there just wasn't one there for me. So in my zip code, or in a drivable distance, really, which is why I had to go a little further outside. Supervisor shortage. I mean, you guys know that 55% of U.S. counties, all of them rural, have no practicing therapists. That's SAMHSA's statistic. So in line with that, there's a supervisor shortage, and I think it's becoming more of a problem today because of the prevalence of online programs. Many more campus-based programs are also developing virtual online degree programs as well. And those students might come from an area where there are no mental health professionals, and so there's not a supervisor there locally to supervise them. And then supervisor fit, and the lady who asked a question, I'll touch on this a little bit there, in the sense that, you know, I like technology, but I would not want to see my therapist online. I don't know why. I don't really have a reasoning for that. I just like going and being in my therapist's office. It's cozy and it's different than my work office, and I would just prefer to do that. And so, you know, I think that when you're thinking about finding a therapist, people think about it a little bit differently when you're talking about supervision online. And I think the reason for that is because it's more peer-to-peer. It's two people who are mental health professionals. And I don't mean to say that in any way to be negative about telehealth. I think it's a wonderful tool that's really beginning to show evidence of being so effective. But I'm just saying, as a personal preference, telesupervision was an easier pill to swallow as my first entry into the world of telehealth. And to that end, I think too, when I was working at an agency, there was only one clinical supervisor available for all of the pre-licensed staff. She was an LCSW. She was really burnt out on the agency, and it really wasn't good supervision, to be honest, but it was the only thing available for free. And I paid for some extra supervision outside of that simply because I wanted the family systems viewpoint that I had just learned about in school and wasn't able to get at my place of employment. So that's a real need for people out there to not just have supervision that's free and available to you, but to have the right kind of supervision for the kind of clinician that you want to become is definitely something that I think drives people to a solution like Motivo. And then I've touched on this a little bit, but also administrative supervision. So a lot of community mental health agencies, they don't have a lot of resources. It's hard for them to keep licensed folks on staff. And I worked in community mental health for a number of years. And the supervision can sometimes be too focused administratively on billable hours and documentation, and sometimes not enough on clinical development and self-care and skill development. So that's another piece too that I think people are looking for. And then real quickly, let me go through some best practices in telesupervision. I think someone asked whether or not this deck would be shared, and it absolutely will. So feel free to take this and look at it and use whatever you find helpful about it. We call it virtual supervision, but it can be called telesupervision, distance supervision, any of those. But what I mean when I say it is supervision through live two-way video conference using a HIPAA compliant medium. And then here's what we would just personally recommend for the ethical use of telesupervision, that you'd have supervision training. I actually love AAMFT's process for training their supervisors. I think that's one of the best things that we do as LMFTs is train our supervisors well. Telehealth training can also be a great thing to take part in, especially if you're new to the use of video conferencing. You guys probably know that CCE has the board certified telemental health provider training that can be helpful. This is something that you guys might differ on depending on the state that you live in. At Motivo, we only match you with someone who's licensed in the same state whether you're seeking licensure. Boards vary on that, but we want to err on the side of caution and just only match people with someone who's licensed in their same state. Obviously, we recommend reviewing the rules together, have an emergency contact plan, and then I linked here to a supervision contract that you guys would be welcome to use. It's on our Google Drive, and it's the one that I created when I was an AAMFT approved supervisor, and you're welcome to use it if it's helpful. And then I'm not going to read through all of these, but there's some best practices in telesupervision. We actually have an entire document on this and what to do before and during to maintain good working environments and to make sure that you're getting the most of telesupervision and not losing anything from not being in person. Some tips here on how to find a good supervisor, and then some questions to ask when you're vetting a new supervisor. I'm thinking we probably have a lot of people on the call today who are supervisors and not supervisees, so I'm going to spend a little bit more time talking about the tool that we have rather than going too deep on how to find a great supervisor. Yeah, so let me just say in summary to this part of it, I think one of the reasons for this move towards telesupervision is because of these board rule changes, because advancements in video technology can make it like being in the room with another person. The rise of online education, as I've already mentioned, is driving more and more people who are in rural areas to realize that they don't have a supervisor locally and they need to find one. And then just the up and coming generation that are a lot more connected and used to technology. So let me move out of this and stop there and see what questions came up maybe so far. I'm just looking through the chats here. How do you review and sign off on client documentation for supervisees? So we have on our platform, you'll be able to see how you can document a session note within Motivo, but obviously a lot of agencies have specific processes like that baked into their electronic medical record. We use the share your screen function on the site to be able to see something that's on the supervisee side of things, but usually that's for the agency to determine if they want to give the supervisor access to their electronic medical record or how they want to share those notes. So I would just say that more generally speaking, it's kind of a case-by-case basis. I'm trying to pause in here in between some of these chats in case anybody wants to say anything out loud. Feel free to just pipe in and interrupt me. Doesn't bother me. Do you have to be an approved supervisor to supervise? You have to be approved to supervise in your state. So if that means that you have to be an AAMFT approved supervisor, some states say that, or you just have to meet the qualifications to provide supervision in your state. Someone asked, can you supervise someone in a different state than where we are licensed, as long as you're licensed there? So you don't have to live there, but many people on our platform are licensed in multiple states, and even if they don't live there, they can. I'll tell you, I see someone here in New York. New York is one of the 5 states that doesn't allow supervision online at all. Pennsylvania is another one. New Jersey is one that that we were initially told no, and now it looks like it's more of like a case-by-case basis. The board might approve it. Yes. Okay, and I see this one from Tara Gans about being a postgraduate working towards full licensure. Tara, are you saying you're a student still right now, or you're graduated?
Hi, sorry, I've graduated.
You graduated. Connecticut, is that what CT is, right? Connecticut.
Yes.
Connecticut's a difficult one. I'll tell you, we've talked to them a number of times, and they have said no, that supervision online is not allowed there, but they're also, they kind of say, we can't tell you. They're unclear about the rules. What I can tell you is that people have used telesupervision, not necessarily Motivo, but they've used telesupervision in Connecticut to get licensed, but the board is unclear about whether or not it's allowed. From my perspective, I would err on the side of caution on something like that. But really, even though we like to share our knowledge of what we've learned about telesupervision as we've researched it over the last 3 years, we also don't speak on behalf of the board. So I won't say anything definitively unless I know that I can point to the board's ruling somewhere in a PDF to show you that. So, yeah, it's Connecticut is probably one of the more challenging ones from the perspective of they just won't be super clear about it. Okay, let me, it looks like there's quite a few more other questions. So let me do a quick demo. Would that be helpful? Maybe head nods if that's something that you guys want to see at this point before I just run through all the questions. Okay, cool. I'll do that. Okay, so when you come to the Motivo website, there's an entry point for both people who are individually looking for a supervisor or agencies. We work with community mental health agencies to find their supervision for them. Just so you guys know, if you're interested in becoming a supervisor with us, it's free to join, and you just click on Become a Supervisor, and you go through the process to create a profile, and we check your license with the state board and then approve you through our site. Very easy process. Again, it's free. You're welcome to become a supervisor. We love MFTs, but don't tell other people that. And then for individuals, most people start from this direction to be able to find a supervisor. They're just looking for someone for themselves, and they get to our directory here of we have about 544 supervisors right now. So you can filter down by the state where they're licensed, and then you can also filter down by licensure type as well. So you can just see just the marriage and family therapists in California. And then you can pull up their profile and learn a little bit about them as well. So you can see that she's an AAMFT approved supervisor, her specialties and modalities, a bio about her. And then she would go through this process right here to schedule a free introduction. So this is when we get some information about the supervisee and find out when they would like to meet with Rosemary. And then we schedule a free video call between the supervisor and the supervisee to determine if it's a good fit. The question earlier about assessing that fit, we empower the supervisee to determine who the best supervisor for them is, mainly because it'd be difficult for us to know who a great supervisor for each person. I was making this example earlier that we've noticed that a lot of women of color come and they would want a supervisor who's also a woman of color. Like there's a very big correlation there we've seen. But then we've also seen people who want to choose from someone who's a total different race, ethnicity, background as them because they want to learn from someone different. So it really is based on the choice of the person who, what they would deem as a good fit for them. So we do that free introductory video call. If both people say, yes, we want to move forward with this, then they move forward using the platform. And now I'll do a quick little demo of that. So this is what the dashboard looks like here. So this is what the supervisor's view would be. You'd be able to see that you need to mark attendance on a few of your sessions, and you'd see your other upcoming ones. Underneath here, you'd see all of your supervisees. A lot of family systems people here. You guys probably be the only people who get these names. Thank you for humoring me for that. And then you're gonna click here to book a session. So the question earlier about Zoom and why this might be different is simply this process right here of the overlay that's on top of our video conference solution that will allow you to pick a remote or in person, and then scheduling an individual dyad or a group session. You can pick it as recurring, and then it would be just a regular meeting that takes place on your calendar. Then you pick which group members are going to be there, or if it's a dyad, you would notate that as well. And then it's here in your upcoming sessions and ready for you when you're ready to start the session. So this link gets enabled 1 hour before the session. You click on that, and then it goes into the video conference session with your supervisees. And then on the back end of things, and this is how we are able to keep track of billing for you, is we have you mark attendance of who was there and who wasn't there. So, you know, when it's a no-show, we still bill them for the session. So this tells us what we need to know. You can submit the session attendance, and then you can also fill out a supervision session note here about what was discussed, what clinical skills were taught, and what follow-up actions are needed. So I'm going to stop my share there. And then I'm going to get through these questions, but let me just first say, you might have noticed on the email that Lissa sent out that we're offering any AAMFT member supervisor who wants to use this for the next 8 weeks for free during the coronavirus, the ability to use it, simply because we thought, like, this is a solution that maybe people need right now more than ever. And some people might not want to do telesupervision forever. And if you don't want to be a part of the Motivo directory, like, that's no problem at all. We would welcome you the opportunity to use the platform if you think this would be a helpful stand-in for you and your supervisees. No strings attached. Yeah, just there to be helpful if you would like it. Anybody want to pipe in with anything before I look through some of these questions?
Yes. Did you say New York, you can't do televised supervision?
That's right.
So none of the supervision that we would do would not count for getting licensed.
That's right.
But there's no problem doing it after they've gotten their license, I presume.
That's right. Yes.
Okay.
Yes. That's right.
Thank you. Thank you.
Well, and I joined late, so I apologize if you've already mentioned this. But there's a process where you would need to turn in the supervisor form to your state board, right?
Mm-hmm.
And so doesn't that usually take more than 8 weeks to get going on online supervision?
What state are you in?
Texas.
Texas. Lauren might be able to answer how fast people are doing that right now. I don't think it's taken 8 weeks. Lauren.
Yep, I'm here. Hey, y'all, how's it going? Lauren from Motivo. So we've actually been really lucky with the Texas boards because they have opened up to do 100% supervision online. We have had people getting approved in 4 to 6 weeks. I heard the LPC board and the LCSW board might be a little backed up, but I had an LMFT in January who was actually in the Austin area who was able to hand deliver it in person, and she got her intern number that day. Wow. So it's just kind of luck of the draw, but we're lucky that Texas is one of the biggest states that we've really seen traction for online supervision. We've been fortunate enough to even start dyads and groups out there. So if that's something you're interested in, would love to talk with you more. My email is lauren@wearemotivo. You should have gotten a couple of emails from me at this point.
Yeah, okay, thank you.
And I think our thinking with the free offer was more if you were in a jam and there were supervisees that you were already approved to be seeing from your state's perspective and you just needed a quick way to move them from in-person to online, then this would be a great way to do it. For net new supervisees, yeah, depending on the state, it might not make sense. Other questions? I love the verbal questions.
Do you know, is that the same situation for California as well? Do we have to submit something to our board? We're in kind of we're all moving to virtual services currently, and we're not able to meet with supervisees in person. So we're hoping to start doing that as soon as this week.
Mm-hmm. California's rule, they're very clear about it, that you can do 100% of your supervision online, and you don't have to get approved for it for online supervision, as long as the associate works in a nonprofit, a government, or an educational setting. You can't do any of it online if you work in private practice. I've asked the BBS if they're going to loosen that during coronavirus and didn't receive a response yet. So you might have more information if they're loosening that during this time, but they did put out a coronavirus update, and the rule still stood that you couldn't do it while you're in private practice.
Okay, great. Thank you so much. We're in a university setting, so I think we'll be okay on our end. Thanks.
Yeah, okay, that's great. Good.
And just to chime in there really quick, Erica, we've actually had a couple of university professors reach out to us in the interim to get going with online supervision. So we onboarded 3 new professors and there are 4 groups last night, actually. So if you need help in the interim, Rachel and I would be more than happy to have a conversation with you and see if there's anything we can do to be of assistance.
Great, thank you so much. I'll definitely reach out.
Yeah.
I see your chat there too, Erica, about, yeah. So almost all, if not all, of the supervision that we do through Motivo is after they have graduated. So universities have their own set of rules for what works and what doesn't, and it's usually managed by AAAMFT or KCREPT, the accreditation body for online supervision. We don't really get involved in that. The university can decide if this is a tool that would be helpful. We just started providing supervision for all of Bethel University through the platform because they were in this jam. They're a campus-based program doing all their supervision in person and needed to move it online really quickly. So yeah. If we sign up for Motivo, can we expect a large number of supervisees that are interested, or will it be difficult to find supervisees? That's a great question, Catherine. It's really hit or miss. I definitely don't want to promise you that you'd get overrun. There's people who've been on our platform for 2 years and have never gotten as supervisees, and then there's other ones that get requested all the time. And it doesn't usually occur because of the supervisor as much as it does the state. So the state that we get the most traffic in are Georgia, Texas, California, Illinois, Tennessee, North Carolina, Florida, and then other states where the rules are either not as as lenient about telesupervision. We either don't get very many people there, or I would say also that just a lot of people don't know about us yet. Telesupervision is still a new idea for most people. So yeah, I hope that answers your question. I would say that you should come with your expectation just being open to happy to take them if they come, but I'm not banking on this for my supervisee pipeline. I will also mention, because I haven't mentioned this yet, that we standardize the rates for supervision on Motivo. So we and supervisors probably have differing opinions on how much what they think about that. So individual supervision is $65 on Motivo. The supervisor gets $50 and Motivo gets $15. Dyad supervision is $55 a person. The supervisor gets $75, and group supervision is $100 or more, depending on how many people are in it. And then group agency supervision is just a standard $90. And those are just set kind of across the board, mainly because what I was worried about having this directory of supervisors was a little bit of like a price war of like who can charge the lowest amount to get supervisees, and that supervisees would then pick their supervisor based on who was the cheapest rather than who was the best fit. And I realized that that isn't like our solution. I don't really feel like is the best solution, but it's the best one that I could think of, and I'm super open to feedback from the community. So if you have opinions on that, share them away with me. But I'll tell you, one of the reasons that we're doing this free thing, we're doing it first of all because we think it could help people. But the other reason that we're doing it is because we're curious about what you guys as a supervisor might think about just using Motivo as a software tool that you pay for the use of the software, but then you take care of payment and set your own rates outside of the platform. So we're kind of interested in doing some research in that area to see if that sits well with people. Yeah, happy to answer any questions about that as well. Is there a list of states that only allow AAMFT approved supervision? Not that we know of. And Minnesota, I believe, is fine, but we can check on that. It's not permitted in Pennsylvania, but I'll tell you that the board is talking about it right now and reviewing their rules. So there could be good news in Pennsylvania.
Can I ask Rachel, what is the ratio right now of supervisees to supervisors with Motivo?
With Motivo, yeah. Again, it's really hit or miss. I would say that there's our more active supervisors have probably between 4, and the ones who are doing supervision for agencies might have as many as 12. And like I said, some people don't have any at all. I would say probably 30% of our supervisors are active, and 70% don't do hardly anything at all.
So there's probably more supervisees that need the service than are able to currently access it.
Yes.
That's fair to say. Okay.
Yeah. That's
Thank you.
fair to say. Yeah. Is this available for Canadians? That's a good question. We had a call with the Canadian Association of Marriage and Family Therapy. It's probably been a year or two ago now. And we were talking about a partnership with them, similar to what we have at AAMFT. And they said that they kind of want to develop their own solution for it. And I don't know where they are in that. We do have some Canadian supervisors. So I think some form of telesupervision is allowed there, but I don't really know enough to say definitively. I don't know what the question, Rita, how would it look on the opposite spectrum? I might need to know more about that. And then our AAMFT approved supervisor candidates appropriate for this platform. Yeah, that's one of the things that I really decided early on when I was becoming an AAMFT approved supervisor. It was hard to find supervisees to supervise. And AAMFT, I know this recommendation has been made to AAMFT to list supervisor candidates on AAMFT's website. That's not the case today. So we felt like we could help a little bit with that, of just giving people a little bit of exposure if they needed supervisees. So we do list candidates, and AAMFT told us exactly how they want it to read for someone who is under mentorship to become an AAMFT approved supervisor, knowing that most states allow you, or most states recognize you as an AAMFT approved supervisor when you're in candidate status. The other thing that we provide, this was in the email, is supervision of supervision, which can happen, our understanding is 100% online and across state lines because you're already fully licensed. So I know I have sometimes I get nervous because I'm in front of so many professionals. If I say anything that's like you definitively know it's not correct, please correct me. I'm happy to hear that and would love to learn. So. A second-year student at Capella and would need supervisor eventually. How would this platform work? Rita, send us an email and we'll definitely walk you through the process. And can you still identify supervisees who can meet in person? Yes. Yes. That's how we handle it for any state where supervision is not allowed. We get the person's zip code and find out how close they are. Florida, if there's anybody on here who has any wait in Florida. Florida is really problematic for us because they only allow 50% online, and the very first session has to be in person. So you still have to find someone who's a drivable distance from you. So that's a limiting factor for us, and something that we kind of feel like if telesupervision is ethical, it should be ethical across the board and not just for 50%. So we're hoping that moves in that direction. There are states moving in this direction. So Texas changed from 50% to 100%. Kentucky just changed their rule, bless their hearts. They had a rule that said that you had to breathe the same air as your supervisor once a month if you were in Kentucky, and they did away with that rule. And so now they allow supervision 100% online, which is great. Oh, Eric Bailey's on the call. I didn't realize that. Eric, you might be able to weigh in on the Canada situation. Depends on the province, he said. That's good to know. Eric is one of our supervisors in Canada. Anything else that I'm missing here? Let's see. Washington State limit. Lauren, do you know off the top of your head Washington State? I'm not pulling that one up in my memory bank.
So for Washington State, I think this person was correct. You can get all your hours from an LMFT, but you can get some from an LMHC or an LCSW, PsyD, et cetera. One of the more interesting rules that I thought was it piqued my brain for the LMHC is that you cannot have group supervision until after you get 100 hours. You can do a dyad, but you can't get a group. And so I don't know if it's the same way for an LMFT.
The dyads and groups it's an interesting thing to bring up as well, Lauren, because I would say that's another benefit of Motivo. A lot of times, if you want to do a dyad or group, you don't know another person that can do it with you. And so we can pair people together. Lauren is an incredible connector, and she has like a photographic memory or something for remembering who needs what. And so she matches people together oftentimes who otherwise wouldn't have met to be in a group or dyad. That's a benefit for the supervisee because they pay less, but it's also a benefit for you because you have a higher rate. And let me mention this too, because I think that there were a number of university people who were on the call. Something else that we're looking at developing, it's this idea of raw data that has to be obtained when you're a graduate student. And I know when I have supervised supervisees before, they'll bring me like their raw data like on their iPhone, and like we're hovering over it to listen to the audio file of one of their supervision or one of their client sessions. Doesn't feel like the right way to do it, and that there needs to be a better solution there. So one of the things that we're looking to develop is a way to capture raw data securely on your iPhone and store it securely in a HIPAA compliant way and upload it to Motivo for review at your next supervision session. And I think that that could be helpful to supervisors in the academic world, whether or not they're providing supervision online or in person. Just having a database of that video or audio file, I think would be helpful. If you think that would be helpful as well, I'd love to know about it. So you can tell me and email me. Yes. So are you saying a supervisor can participate in a therapy session in real time with a client and supervisor and provide live supervision through Motivo? No, not really. Like our platform doesn't really touch any client interaction today. It's just the video call between the supervisor and the supervisee where they're reviewing things together, and part of what they might review is an audio or video file of client sessions, or it might be case notes, or it might just be talk supervision of what occurred. How does the standard fee for supervision not violate the federal antitrust regulation? I might need more information on that one. Maybe email me there. Anything else, Lauren, that you see in here that we can answer top of mind?
Yeah, I think these are all some really great questions. I just want to go back to the New York piece for a second, just because we have so many inquiries that come from New York. One of the reasons that online supervision has not been allowed in New York yet, and for any New Yorkers on the call, you're probably familiar with this, that licensure goes through the Department of Education. And thus, because it's the DOE, we just haven't been able to get any traction with getting technology-assisted supervision approved. So if you know anyone at the Department of Ed and you want to put in a good word about online supervision, we would be very much obliged.
Mm-hmm. Someone asked if the process is similar for supervision of supervision. The only thing we do differently there is that we allow the supervisor of supervision to charge their own rate, and we just tell the supervisee what it is. So it's a bit problematic sometimes, but one of the things that we're thinking about doing is creating 2 tiers of pricing, maybe the standard level and then a little different. And then maybe we're looking at also doing rates by geography of like where you live and kind of what the standard rate in that area is. And this is probably just kind of from my own ethos that gets in the way here, that I think supervision had become a little bit cost prohibitive for early clinicians in my belief. And I like don't necessarily need other people to agree with me on that. You know, like I think that any therapist should charge whatever rate they want to clients, but supervision, all of them are early career clinicians that aren't yet making full salaries. And I just felt like it needed to be easier to access. And if that differs from how you feel, I completely respect it. And I don't think Motivo's right for you for probably that reason. That's just kind of where we landed with it. But again, always open to feedback.
Can you talk a little bit about Hawaii's process for online supervision and what they're doing with that right now?
Yes, good question. I don't have Hawaii top of mind. I wonder if anybody on the call is from Hawaii. I know we have supervisors in Hawaii, which makes me think that it's probably allowed for some of your hours, but I would want to look into it for you. Is that Nancy? Who said that?
Yes, it's Nancy.
Nancy, yeah. If you could put your email there in chat, you can send it directly to me so everybody doesn't see it. Then we'll follow up with you and find out what we
Okay,
can find out. Yeah. Feedback, thoughts?
Just saw somebody else ask a question earlier about raw data, and Rachel, I think you touched on this a little bit. What most of our supervision matches do, especially in states like North Carolina, where you have to have access to raw data to share during supervision. If you look at the bottom of your Zoom screen, you'll see a green share button. On Motivo, we have the same functionality. So that allows for our supervisees to share files from their sessions. In addition, sometimes we have our supervisors want to play a YouTube video, to share a TED Talk, or watch some training. And so that's one really great way to be able to have that interactive component during your supervision session.
Yes, I think that's a great point. Lauren, I was just going to ask you, could you real quick put in the chat message, the link that people can go to add their supervisees to Motivo, just so that people have it handy there. That would be the process if you're saying, like, this is totally me, I have in-person people and I don't know what to do and I want to use this platform, then again, happy for you to do so. And all the information is in a post that Lauren will link here.
Yep, it's coming, just grabbing it from the blog.
Cool. Yeah, great. This has been super helpful. Another thing that we're doing at Motivo, if it's of interest to you, is that we're just having like a Wednesday night support call that is therapists who are freaking out about COVID-19 a little bit and just need a place to kind of be together and talk about, you know, what's happening to their practice personally, or they just need a break from their children for just a little bit. We just talked about a lot of different things last night. It's free, of course. It's just a time for people to get together and talk about whatever's on their mind. If that would be helpful to you, reach out to us. I'm going to here put my email address, and happy to send you the link for next week. We are doing Wednesday night, Rachel at wearemotivo.com. Wednesday night at 8:30 p.m. Eastern time is when we're doing it, and would welcome you there. I read something the other day that said the real winners of COVID-19 are our dogs, because they're getting just all kinds of time with us right now. So. All right, well, we just have a couple of minutes and I'm happy to end early if there's nothing else that's needed. I really appreciate everybody being here on the call today. If you have specific questions, feedback, anything like that, you can reach out to me. But let me just give one last pause and see if there's anything else that anybody wanted to ask and they didn't get answered.
I have a question. Hi, thank you so much. You might have seen my tiny human running back and forth in the background.
No, I want to see your tiny human.
Okay. There she is.
Aww.
Definitely
in training.
You know, in the right in this you know, as we're dealing with this pandemic, and if we're going to use this platform, and I don't know if this is an appropriate question because it's not so much about technology, but we're home and many of us have our children with us. How are we managing? I mean, I'm not so worried that she's going to violate HIPAA, and at the same time, technically, she should not be in the same room with me when I'm providing supervision. And we're in a pandemic, and there's not a whole lot of options. And I'm just wondering how people are managing childcare and, you know, having people and multiple people in the home and privacy issues while they're providing supervision.
Such a good question. I think that's definitely something that we are exploring on Monday nights, and a good forum for it. I'm happy to kind of pause and see if anybody else has any questions on that. I would be like, here's an iPad and headphones, but maybe that's how those people are getting through the day as well.
I might be able to add something. I have a couple of, this is Elizabeth and I'm in Kansas City, Missouri. When you use HIPAA compliant software, it automatically, like I know through Theranest or Zoom or a lot of them, if you're doing HIPAA compliant, there's a microphone mute button so that if somebody walks into the room while you're in session, you can mute your client or mute your supervisee. So let's say your husband's walking into the room and your client's disclosing, sex abuse. Hopefully it's not your husband. But you can mute that immediately. Like right now, my child just walked in the room and asked me for knee pads. And then a lot of moms here locally are starting to rally. All of the schools in Kansas are closed for the rest of the year. And so we're rallying and finding each other's high school students or college students, like the college students that have had to move home. I know we're under pandemic or under quarantine, but once they've passed their little 14-day phases, we're kind of sharing names for college students to come in or high school students to come in. My nanny is a high school student. She lives right down the street. Her mom hasn't let her go anywhere. She's here now watching my girls while I do online sessions, not for the whole time. So anyway, those are just some brainstorming thoughts for you that we're kind of dealing with as we're trying to figure it out too. It's hard.
That is certainly a challenge. Yes, just a couple more questions that came in. I want to say providing co-therapy option with supervisee. I wouldn't use Motivo. We're not really set up for client sessions. The video call is fully encrypted, but what isn't encrypted is the payment piece, which probably doesn't really matter in that situation, but like from the perspective of client patient health information there, I'm not actually sure exactly what else we need to do on the payment side of things to make sure everything, obviously your payment information is secure, but there could be names that would be visible to members of our team. So I would err on the side of caution and say that we're not set up for direct services. And yes, you did hear correctly, the person who asked about AAMFT credential supervisors seeking mentorship for credential. We can list you on the platform as being able to do that, and supervisees can access a supervisor for that reason as well. And I feel like there was like one more thing I was gonna say, and I don't remember what it was. So if there was anything else that we didn't, oh, I did just want to mention, because a lot of people think that because Zoom has a HIPAA compliant offering, that Zoom is HIPAA compliant, and Zoom out of the box is not HIPAA compliant. So they have a telehealth version. It starts at $200 an hour, and you have to sign a business associates agreement with Zoom for it to be fully HIPAA compliant. So I just wanted to just be clear about that and make sure that people know that as well. And perhaps it might be a good idea for people to throw in the chat whatever telehealth platform you're using for client sessions, because I think a lot of people are curious about what to use right now. And I think I just answered that question for you, Gloria, about Zoom only being HIPAA appropriate if you have the business associates license with them.
Yeah, the Zoom is very expensive. In Kansas, the therapists here are using their electronic health record platforms. Either Theranest or Simple Practice are both very popular here. And then for people, like I have a few supervisees with small practices, they are using the free version of Doxy, which is HIPAA compliant, supposedly. They have a BAA from there, but I'm telling them to investigate that. But that's the free one that they're trying for now.
Excellent. And some great ones just came up in chat as well. So take a look at those. Why don't we include those, Lauren, in the follow-up, the list that people recommended?
Yep, I heard Doxy, I heard Zoom,
Clocktree, Simple Practice, VC. There's a lot of good ones.
I wanted to clarify too, I've seen this posted on several therapist websites that they have actually lowered the standard for HIPAA compliant software, but there's some false information. When it first came out, the local therapists in the Kansas City area interpreted that to mean that because of the crisis, we didn't have to use HIPAA compliant software, but they've actually clarified now that that's not true. we are to use HIPAA compliant software, it's if for whatever reason HIPAA compliant software is not available to us or our client. So let's say you're working with an elderly person and they don't have an iPad or a computer, you can breach HIPAA, or you can breach that and not use HIPAA compliant software so that you can still provide services to that elderly person. Or let's say you had somebody who they really needed a session and the technology wasn't working. It wasn't meant to be that we didn't have to try to use HIPAA compliant software. It was that if the client somehow fails that, and that's from well, never mind. That's from the powers that be, and that's coming from the BSRB.
Very helpful. Thank you. Great. Thank you. So good to see y'all's faces. I've only seen my husband for days, so I'm so glad to see so many people. We've made up imaginary coworkers around here because we're in need of other social stimulation. So thank you for being just kind of a bright light in my day. We will send the recording of this out to people as well as some notes. And if you have questions, reach out to Rachel at wearemotivo.com or Lauren at wearemotivo. Alyssa, thank you so much for putting this together for us from AAMFT. And yeah, you guys stay safe and stay well. Thank you.